Effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
When someone writes something for you and you're a public speaker, you want them to write it in your voice. Don't use big words. I'm not making fun of anyone for mispronouncing things. I do it all the time. Mostly laziness. Trump, just go with Tylenol, not good. Today, the Trump administration officially claimed that taking Tylenol during pregnancy can lead to a higher risk of the child developing autism, despite serious concerns from medical professionals. Here's more of what Mr. Trump had to say with Dr. Oz and RFK Jr. standing by his side.
Taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think.
And somehow, as he was getting into all that, I couldn't help but think about all the women out there whose partners make them sick. And I can think of one who's chosen to live in New York. New guidance has alarmed people in the medical community, many of whom say it's far too early to declare that there's a link between Tylenol and autism. Here's Dr. Scott Gottlieb, Trump's former FDA commissioner, explaining.
Does Tylenol cause autism?
Well, this has been extensively studied. There was a study in JAMA in 2024 with 2.48 million siblings, showed no correlation. There's been some small studies suggesting that there could be a correlation. Again, worthy of further study, but there is no clear evidence that it causes autism for women who take it during pregnancy. And if you look at utilization rates in pregnancy of Tylenol over the last 20 years, it's gone down. So there was about 70% utilization of Tylenol in pregnancy, any administration, so people who might have only used it a few times. Now it's about 60%, and over that time period, autism rates have gone up, not down. So it doesn't suggest there's a correlation.
So there's another one of Trump's, former guys, his guy. So many medical organizations, including the Society of Obstetricians and Gynecologists of Canada, the American College of Obstetricians and Gynecologists, the Autism Science Foundation, they endorse the safety of using Tylenol during pregnancy, the Autism Science Foundation. See the charts there? Over the weekend, even Trump seemed to acknowledge that his administration might be wrong about this.
I don't want to wait any longer. We don't need anything more. And if it's wrong, it's right. It's not going to be wrong. But if it is wrong, it's fine that we have to do it. Because we're going to have an announcement on autism.
Just push full steam ahead. No, it's not fine if you're wrong, because there are serious consequences to the federal government making declarations about people's health. Pregnant women already have very few options when it comes to pain relief. Putting out unsubstantiated information about the dangers of Tylenol is sure to impact many of those women, leave them with even fewer options for dealing with pain. And during today's press conference, Mr. Trump didn't stop at Tylenol. He also fear-mongered about vaccines to the point that even RFK Jr., this is rich, had to temper his claims.
And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say.
You're less careful than Bobby, and so we're all in a lot of trouble. So that's an inaccurate claim. Autism is present within the Amish communities, albeit at lower rates. Mark, I don't know what to do with this. It was like mumbo jumbo. It was just like a fiesta of nonsense that he was spewing again and again, looking around. Is that right? Struggling with the only word he probably should have known, even though, again, people mispronounce things, even though he's the president and speaks all the time. What do we do with this? There's people out there, and I worked with a guy who really grifted a long time ago. He would go to the autism community. He would say, I got a big announcement. This is going to cure things. This is going to be the game changer. And these were people who loved their children and just wanted an answer and wanted some help. It's the worst. And I think that the consequences are very serious for people who would not know any better.
Well, I'm glad you gave that example because I think it's sad. I think there's an exploitation associated with it. There's an exploitation, even if it's not a grift per se, it's an attention grift. There is always on the part of Trump wanting to make the announcement. We have a big announcement about autism. We got a big one, and then he makes the announcement, and you realize he's jumped to a conclusion. And it's interesting to hear him say, a lot maybe want to wait and get more information. I think we've waited long enough on this. We need to move ahead, from a crew that is completely populated by people who feel as though the data on, for example, the MMR vaccine or the polio vaccine is still not sufficient to say, okay. I mean, these people want to wait even longer on that, and it has a proven track record. So I understand that there can be legitimate debates around many medications and many vaccines, but this is completely irresponsible, and it's sad for the reasons that Sharon says. I mean, it's the way in which so many who are parents to autistic children desperately want to find answers. They want to find treatments, and we'll get to that in a second. And then they want to find causes. But I also just feel as though there is a huge clapback waiting to happen. I mean, you can't say irresponsibly, as we've kind of noted, that acetaminophen or Tylenol is responsible in any way for autism and not end up possibly in a court case over that. I mean, you better be able to show your math. You can't just say something like that as president of the United States or as head of the FDA. So I think there's a lot here, and it's way irresponsible. And as I say, there may be some civil liability.
Yeah. Well, the makers of Tylenol put out a statement today saying, whoa, pump the brakes. We couldn't disagree more. This is not scientific, paraphrasing. They push back hard. I just wonder though, Mark, if in pushing back hard, we've seen how this administration rolls, if they will then face consequences, if you will. I'll give you the last word.
No, that's exactly right. I mean, that's why Tylenol, even in that statement, they have to walk very softly because they're worried about clapback from the Trump administration. They can end up really getting destroyed by government. So you're right. The whole thing has to reach a kind of balance, and yet the record does have to be corrected.
Every time you ring the bell below, an angel gets his wings. Totally not true, but it does keep you updated on our live shows.